Welcome back to the Daily Sip at 3:30. AMR is rolling out a new program called Nurse Navigation. And here to tell us about it is Ryan Wilson, Operations Manager with AMR Central Mississippi. Welcome to the show, Ryan.
Yeah, thank you for having me.
What is Nurse Navigation all about?
Yeah, this is a program we're very excited about. The idea being that we want to really fill a healthcare need that we found in our business. And what the program is designed to do is to take certain callers that call with maybe less severe needs, right? Mm-hmm. So think about toothaches and earaches and cold and flu symptoms. And, you know, traditionally their only option once they call 911 for those types of things is to go to an emergency department in an ambulance and kind of work through that process. Yeah. And so what we aim to do is capture those callers and basically give them more options, right? Okay. So instead of having to send an ambulance in the emergency department, we can actually connect them with a state licensed nurse who can really take some extra time, talk to them and figure out what's going on, and perhaps they can help make an appointment at a local clinic. They can maybe connect you with a telehealth physician. Sometimes we get calls for people just needing medication refills, and so we can actually help arrange transportation to and from a pharmacy. And so really give people options that can best meet their needs.
Yeah, well, that could be a lot less expensive on them too, you know, not having to foot the bill for an ambulance ride or an emergency room visit or something like that when they need a refill on their prescription is the only thing they need.
Yeah, that's exactly right. You know, emergency healthcare in particular is some of the highest cost healthcare out there. And so one of the great things about this program is, one, it's free to use. So you will never see a bill from, say, AMR just for using the service. Mm-hmm. The only cost would be if you, say, go to a clinic, whatever the clinic may charge, the cost of your medication. But this service is completely free, and it's also voluntary. So we're not going to force anybody to use it, but we definitely want to make it available.
Now, how does somebody, if they have non-emergency, like a toothache, and how do they get in touch with you? Do they dial 911 and somebody sends them to you, or what? Yeah,
good question. So from the caller side, there's really nothing that's going to change. So these are callers that are already using the 911 system. So they will call 911 just like they normally would, except this time now we can ask you, hey, would you rather talk to a nurse who can maybe help you work through the problem? Yeah. Get you help quicker, more, like you said, more efficiently.
Yeah, got to do a little triage over the telephone there.
That's exactly right.
Instead of waiting to get to the emergency room and then going, oh, you know, you really didn't have to come in.
That's exactly right. Yeah. And this all has a physician oversight. And then for us, what it allows us to do as well is make sure we're keeping ambulance available for the severe cases, for the heart attacks and the strokes and the car accidents. So it just works all the way around.
Great. Good deal. And this is available now?
So we're looking to launch this in December. We've already started going through the process of putting all the pieces together, but our aim is to have it live in December.